Hi, this is Christian from WildHawk Physical Therapy.
And I'm Ashley from Wellness Warriors and Wisdom Massage Therapy.
And today we'd like to just talk a little bit about how physical therapy and massage therapy can really work well together. And that not one is superior. So really having a marriage of those two things is really a good solution for a lot of people.
Yeah.
So I know in my experience, I see a lot of patients who have chronic issues, or they have multiple body areas that are really bothering them. And with our hands-on manipulations and stretching that we do, we can certainly get them better. But I think for a lot of our patients, we like to see that they have a little bit more hands-on deep tissue massage care, which we do some of that, but not to the extent that you would maybe do. And especially for patients who've been in car accidents where they're really dealing with a lot of different areas at the same time.
Sure.
I find that sending people to massage can really help get them better a lot faster. So with a combination of the hands-on physical therapy and exercise and massage.
For sure, couldn't agree more. I see a lot of referrals from physical therapists with the same mindset. Our goal as practitioners and therapists on both sides are whole person health. We want to get that person more functional and feeling better and healed faster. And studies have shown that both therapies together, it escalates that healing process. With massage therapy, a lot of the blood flow is increased, which blood flow increases oxygen, which is really going to help heal those muscles and injury areas. I see a lot of people that come to me from injuries such as car wrecks and things like that, and it's really nice when you have more than just one region of the body that is in pain or needs some work. We can devote a little bit more hands-on full body time for them.
Yeah, and I think, at least in America, there's kind of this almost, not necessarily divide, but maybe these disciplines aren't communicating to each other very effectively, where maybe, you see in other countries, like in Europe, massage therapy is really a big part of healthcare.
Oh, yeah.
And people love it, and it really helps. While in America, I feel like, there's physical therapy in one box, and maybe massage in another box, and chiropractic in another, and these three aren't really talking to each other.
Yeah.
So I think really uniting kind of our different approaches and what we have to offer is super beneficial for patients, and keeps people away from injections and surgery, pain medications.
For sure.
Because we can really help get hands-on and work to really reduce pain.
Sure. I sometimes will refer my clients to a physical therapist as well, or even to a chiropractor, as you had mentioned, because not one modality by itself is, like you said, superior. Working together is going to be so much better for the person as a whole, as opposed to just saying one thing at a time. One thing I often tell my clients is, if you're referred to me from a physical therapist, a pain doctor, or a chiropractor, don't stop going to them just because you're coming to me. Continue your therapies, and also let your physical therapist know that you're getting massage therapy and what your massage therapist is working on specifically, because together it can make the whole treatment process different in a good way.
Yeah, absolutely. And for our approaches, I really like, at least maybe what we do differently than some other physical therapy clinics, is we do dry needling, which, we can talk about trigger points all day, because you see them all day.
For sure.
But we love to target those with dry needling, and do joint manipulations to really get things moving. But sometimes those trigger points are really there, and they've been there for a super, super long time.
Yeah.
So that's just a specific example of where I really like to refer people to massage, to say, hey, keep coming to therapy, keep working hard on your exercises. I want to see you again, but I also want you to go get a little bit more attention to some of these specific regions where someone can really, get their hands in there and work out some of these trigger points.
Sure. I see a lot of patients come in with major trigger points, especially around their shoulders, and that can be from just everyday use of computers. bad posture, thoracic outlet syndrome, you name it. There's so many areas in the body that we can have trigger points. And a lot of times those can hinder the progress of physical therapy advancement. And so if we can get in there as a massage therapist and help release that, that means physical therapy and those exercises with that are going to be so much more beneficial to the patient and to the client than if it were just them trying to tough it out through the pain. Living in pain is not always just being the tough guy. Sometimes you need a little bit of help. So
yeah, absolutely. And I think one of the nice things about North Carolina specifically is that it's a direct access state for physical therapy. So you can come see a physical therapist without a physician's referral. So that means you can get in the door faster to come see us to see, if you're appropriate for physical therapy and, if we would recommend massage as well. So I think that's one of the nice key things about North Carolina that it has to offer.
absolutely.
So we'll be talking more about some of these specific topics regarding how physical therapy and massage can work well together. We're going to focus a few videos on specific body regions or maybe problem areas that a lot of people might have trouble with. So look for those videos to come in the future. Again, I'm Christian from WildHawk Physical Therapy.
And I'm Ashley with Wellness Warriors and with some massage therapy.